Hello. This is Auntie Linda once again. Today we are talking about our pregnant women, how they get tested, and what happens after testing. Okay, in my country, Ghana, when a pregnant woman visits the hospital for the first time, the protocol says we should do the HIV test. We are not forcing, but we sell the idea. We counsel them. We give them the education on HIV. So they end up doing the testing. And we make it known to them that when you test positive for HIV as a pregnant woman, we can help you prevent it from giving it to your unborn child by putting you on the antiretroviral drugs. After selling the idea, you end up getting all our pregnant women being tested. Those who test positive too, we put them on medication. They take the drugs for life, but during their pregnancy period, they come to the clinic for the HIV drug refill till the baby is delivered. And when the baby is delivered too, the baby is being put on a suspension HIV drug. Not the full drug, but a suspension, because that baby is not HIV positive, but is exposed to HIV. So we call them exposed infants. Till the baby is tested and the result says the baby is positive, you don't use the mother status to declare that baby positive. Okay, so our exposed infants, they also go through their process. We monitor them as health workers. 3 days, we do the first test for them. 6 weeks, we do the test for them. 9 months, we do the test for them. And then 18 months, we do the final test, which is the antibody test. The 3 days, 6 weeks, and 9 months are PCR, early infant diagnosis. We take the sample and then we send it for the test to be done. Okay. While these tests are being done, they are also on their medication as exposed infants. We monitor them. We give them their drugs. They take it. When it gets to a point, maybe two months, we take them off some of the drugs, and then we leave them on a prophylaxis that they will take till the baby will be 18 months for the final test to be done. HIV positive mother can breastfeed if only the person is on antiretroviral drugs, because it's the drug that will help the mother from giving the HIV to the unborn child or to the exposed infant. So if a mother is HIV positive and is on medication, can breastfeed. Being HIV positive doesn't end, you are on medication, doesn't stop you from breastfeeding. Some people may be afraid and they don't want to give their children breast milk. We are not forcing them to breastfeed, but you can breastfeed as an HIV positive mother, provided you are on antiretroviral drugs. And the exposed infant too is being managed, because we don't give them folders as positive babies. We just monitor them, do documentation, and monitor them as exposed infants till they are 18 months and the final test is being done. Last time someone asked me a question and said, how can a pregnant woman give birth to a negative child? It do happens, and it is real. If only that pregnant woman takes antiretroviral drugs serious and takes it religiously. If you take it religiously, your baby will not have the HIV virus. That is why we urge every pregnant woman to get tested. That is why we urge every pregnant woman to follow the protocol, the process we take them through for their babies to get a negative result. I am a happy person because where I work, we've never had any positive baby. They've all gone through it. At the 18th month, you test and they will be negative. And they will be discharged. We take them out of our system and then focus on the mother who is HIV positive. That is what we are praying for. We are eliminating mother-to-child transmission of HIV. So I think if someone is HIV positive around you, or you are even HIV positive and you are pregnant, don't lose hope. Don't abort the pregnancy. Keep it. But rather, take your antiretroviral drugs and have your negative baby. Life goes on. There is life after being positive for HIV. As a pregnant woman, you don't need to worry your head. Focus on your drugs, eat well, and then have your negative baby. You know Auntie Linda loves you so much. Auntie Linda is there to assist you in any way for you to be happy. Because I believe that being HIV positive doesn't mean you are not a human being. I believe that being HIV positive, you can still give birth. I believe that HIV positive person can have a negative baby if only that HIV positive person adheres to the protocol. Thank you so much for listening to Auntie Linda. Thank you so much for watching Auntie Linda. Continue supporting me by sharing these videos. You may not know what you are doing, but you are giving hope to someone. You may not know what you are doing, but you are taking someone from something that is suppressing him or her. Let's do it together, dear. Let's fight HIV and AIDS. Let's end AIDS and let's continue to protect ourselves because HIV is real. Bye-bye for now.